Hi, I'm Maria Sutherland. The purpose of my presentation was to educate on fall prevention. I chose Swick nursing students as my population, and the health-related issue was fall prevention. I came up with this topic for the project because I work in the hospital and our most reported adverse event is falls. We have many issues that come from the falls. There are many hip fractures, people get afraid, there's comorbidities related with the falls. Our population at the hospital may break their hip or just lose mobility from this. I chose this group because I feel that after taking Nursing 451 that they could use this knowledge and it could help them in their care every day of their patients. I feel like if they understand the Heinrich Fall scale and all the interventions we use at the hospital, this can help in their nursing practice. They were just finishing up their fundamentals, so they didn't have quite the knowledge of the medications. So I made a PowerPoint presentation and I went over step by step really what they could do to help with falls. I educated them on the risks of falls and some false facts that they cause the broken bones injuries and head injuries. That 3 million people are treated every year in the ER for falls. 300,000 people are hospitalized for hip fractures. Also that they're the most common cause of traumatic brain injury. So this leads to almost 700,000 people being injured yearly. And according to the American Nursing Association, 1/3 of these can be prevented. So I did give them preventative measures. Some of those, one of the most important ones I think that we use in the hospital and community setting is the Heinrich Fall scale. So I went through the Heinrich Fall scale and how many points you get for each thing. Went over the risk factors such as confusion, disorientation, impulsiveness, depression, the dizziness, the vertigo, gender, and the anti-epileptics as well as benzos. Then I explained the Get Up and Rise test to them and how to implement the fall risks. When I did this, I explained what we do for fall interventions, the fall risk bands, the signs, the stickers on the charts, how to use bed alarms in your nursing rounding to educate the patient on how to avoid the falls. Also the physical therapy and occupational therapy consults we could do. And then the medications. And I broke these down and made them easy to understand, not just like a benzo or anti-epileptic, but told them how to do a stand to sit risk test where if they're dizzy, have them sit back down and let you know, and new medications and if they make them dizzy or not. I also explained the importance of vision testing and a patient's need for removing cataracts and multifocals, how they can increase the risk. I then went into the blood pressure checks and how a lot of patients are on new medications for blood pressures and what they can do to decrease that risk. I told them how to keep it simple with their education when they do their hourly rounding. Don't over educate the patient. Just do 1 or 2 things at a time and ask them to repeat what you said. Then I went into a home fall safety checklist. I went over, the fall risks, and they had a printable checklist as well as a quiz. I think that this will definitely help them in their future nursing careers. I also used the Paracel pad and the safety alarms and taught them education on that. In summary, I feel like I was a little nervous, just like I am now, giving this presentation, but it did work well as far as the PowerPoint and the visual aids. I have a lot to learn on public speaking, and if I could change this presentation again, I would do it in a more controlled situation where I could not be interrupted as easily. My takeaways from this class were there's a lot of things we can do in community health to help our patients. Everyone seems to be on the same page in this class, as well as outreaching to the community and trying to make a difference in whatever they feel strongly about. And I think we all took a lot away from 451, and it led into us being better in our nursing care in the community. I definitely have joined a new committee on fall safety, and I feel like I'm taking away how to communicate better with all of the different healthcare workers I come across, as well as just a whole expansion of the community-based care that we can do. Thanks.